Good morning everyone, I'm just getting ready for work today. I sound pretty upbeat, which is surprising. I'm surprising myself because I have not been feeling that way at all for the past 2 weeks. I don't know how to explain it, right? I just feel really demotivated, and it's not that I don't want to be at work, it's that I want to be at work and also other places. And it's not like I'm sick of people at work, it's like I just want to see my family, and I've talked about this previously as well. But there's so many confusing feelings because I feel guilty if I say that, I feel guilty if I complain because of everything everyone's gone through this year. But also I'm just really tired and I just want to go to Korea. I usually don't go a whole year without not going to Korea. I've been going to Korea every year for the past 10 years, I'd say. And now I can't do that, and it's been over a year since I've seen my sister, my dad. It's just really horrible. But anyway, I thought that I would do a little Q&A. So a few of you at KCL have been emailing me the same questions, asking me to answer some of your questions. I guess part of your coursework is asking a pharmacist certain questions. You guys have emailed me, so I thought I would answer them today. The first question was, where did I study pharmacy and where did I do my pre-registration training? And the answer is, I was lucky enough to do a split placement. So I did half of my pre-reg in community with Lloyd's Pharmacy and half was with a mental health hospital. The second thing is, what do you enjoy the most about being a pharmacist? Well, that's kind of a funny question to ask me now, considering how, demotivated I'm feeling. But what I enjoy the most about being a pharmacist is the fact that you can actually help people without touching people. And I know that sounds really crazy, but a lot of the healthcare professions, like physios, doctors, nurses, it involves kind of touching people and being right there, the physical contact, right? And I've never really been that into that. So I like the fact that I can still make a difference and still make interventions, but just from one step back from that physical contact. Obviously, we still get to talk to patients and ask them what medication they're taking and ask them to get us to ask questions about their medication, but it doesn't involve physically actually touching someone, which I really like about the job. Also, when COVID happened, I remember, well, it's still happening, but in March, I just remember last year when 2 places were open, and that was the grocery stores and pharmacies. And that was when I truly thought, damn, I wanted to do dentistry before that, but pharmacy is really essential. And I felt like it was, crazy just how when my parents had talked about the importance of having a stable job, I chose pharmacy, and that was one of the places that were staying open. To me, that just showed me that I made the right decision in this career path. I'm going to answer this question, then I'm going to get to work. The third question is, what do I find most challenging about being a pharmacist? I find the most challenging, firstly, the fact that people don't understand what your job really is. Everyone's a bit confused. It's what do pharmacists actually do? Do you just count tablets? So the public's perception I find difficult to deal with. The second thing I find hard is the fact that sometimes doctors think that you're working against them, when actually the overall goal is the safety of the patient. So I'm not looking at doctors being I'm gonna fix doctors' mistakes. That's never in my head. It's more okay, this dose is wrong, so that could potentially harm the patient. So the patient is my end goal. And I think sometimes doctors think that we're coming to them and just being annoying or trying to tell them that they've done something wrong, but that's never what we're trying to do. So I find that quite difficult, and it takes time for them to adjust and to understand that you're not actually there to police them, you're there to help. So that's what I find hard. And the third thing I find challenging is the fact that you're just expected to know everything about drugs. So sometimes doctors or nurses will just call you and be like, how do I give this? And what's the dose for this? And if you know it, then that's great. But most often I won't know it. I'll be like, oh, I'll have to search that and get back to you. It's kind of an expectation well, you're the drugs person, you're the pharmacist, you should know the answer, which is true. But sometimes I won't know the answer there and then. So that's something that I find challenging as well. I don't know about you guys, but I am so weather dependent. And this disgusting weather out there is actually just really getting to my mood at the moment. But let's try and take a step back. And the only thing that's stopping me from happiness today is myself, and I know that. So I keep telling myself that, and I'm just going to try and plow through and get through the day. I'm covering 2 wards today. It's the maternity ward and the respiratory ward, and then I've got technical services, and then I've got late duty if they need help. So that is the plan. So let's get there. Today's outfit of the day is just this nice simple black dress, which I got from charity actually. So I took a French Connection dress to charity, and then in exchange I brought this home, and this is, I don't know what brand this is, but I really like it because of this like square kind of v-neck feel. I think it's really cute. Also, I want you to know that I actually made an effort today, like straighten my hair and put in earrings, because I'm vlogging. So thanks for making me feel more ready for work, because at the moment, obviously as I'm still in technical services, I've just been going like random clothes and not making an effort for work. But today I've made somewhat of an effort, so thanks to you guys who sent in those questions. Another question that I got was, what's the latest moral or ethical dilemma that I faced? And it's difficult to think of an example, and I'm not going to use one that involves a patient, but basically I had a friend, like someone that I knew, who asked me, well, he needed some sort of proof that he was in hospital, but he couldn't get that proof, and he wanted to get reimbursed for something. So what he did was ask me to get a drug chart and write his name on it and put names of medication on that drug chart, almost as if to pretend that he was in hospital. And I found that really hard, because first of all I was shocked that he would make a request like that, and then secondly I just didn't expect that kind of dilemma to happen in my life. So I didn't know how to deal with it, and I felt like, oh, what if I don't do this? Then he's not going to like me anymore as a friend. But then also, what's the consequences of me actually doing that? And the fact was that it was not possible to do it because it was a lie. Like, he wasn't in hospital, so I couldn't just put his name on a drug chart with medication on it and be part of the proof that he needed. So I just politely declined and said no. And I haven't really spoken to that friend since. But I'm okay with that, because, like, why would I lie? Why would I do something that I don't feel comfortable with? And that's the thing. Always go with your gut instinct. If you're not comfortable signing something off, or you're not comfortable doing something for someone, have the courage to just be like, no, I can't do that.
This station is Tottenham Court Road.
Okay, so I was just thinking this on the ward actually, but when I was talking this morning about how pharmacists don't have to have that physical contact with patients, it's just so visible because everyone on the ward is in scrubs, but pharmacy doesn't need to be. Like, I was actually wearing this on the ward today now that we're a little bit better and cleared of COVID patients. So that was one thing, like, it's genuinely visible proof that pharmacists don't need to be in like full-on physical contact with patients, which I think I prefer. So the next question was, how do you keep up to date and how do you decide what you need to learn? I find this really difficult because I'm not a natural like inquisitive person who's like, oh, I want to know about this condition, I want to know about that, which I should be, but I'm not. So on-call is actually really good for me, and I feel like because I know that I have to answer the question, I have to do the research. That's something that like I have to face there and then. That is something that's helped me keep up to date. Another thing is I learned from one of my senior pharmacists who's actually left the trust now, but she would say, if you don't know something, search it there and then. Like, I used to have this whole list of conditions that I would like tell myself that I'm going to study when I get home, but I just wouldn't. So she was like, don't just like write a list of stuff for you to do, just do the list now. So if you come across a condition you've never heard of, just Google it. And it's better to do it there and then than not at all. So that's one tip I also have. And how do you decide what you need to learn? Well, you'll come across common conditions. You'll see on particular wards conditions that are very common, that keep coming up. And if you don't know about them, then it's just not going to help you be a good pharmacist. So that is one way that I decide what I need to know. So I've been on the ward and now I am off to lunch.
Yeah, what's happening?
Guys, I was really supposed to film like the answers to all my questions today, but like it's just been so hectic and I haven't had a chance. I really wanted it to be like an interesting day in the life whilst answering your questions, but I haven't had the chance, so I think I'm going to try and film and finish your questions off at home. I hope that's okay. It's the next day. It's just been really hectic for me to film, so I'm just going to carry on the Q&A like normal. But the next question is, how do you ensure you're practicing evidence-based pharmacy? I think that this is definitely easier in a hospital because the guidelines are constantly reviewed, and for things like COVID, it was trickled down from seniors, like, okay, there were these trials, these drugs seem to work, these drugs reduced like inpatient stay on ICU for patients, whatever, so then this is what we're going to use, and we had to use those. So I think like evidence-based practice in hospital is a lot easier. In community, I think that would be harder because you're not in direct contact with other healthcare professionals as much as you are in hospital, and you're not necessarily following guidelines, you are just, you know, checking, accuracy checking, legally, clinically checking prescriptions. So I think it's harder in community, but in hospital there's no choice but to practice evidence-based pharmacy, because that's the whole point of a hospital pharmacist, to follow the latest guidelines. I mean, keeping up with them is difficult, and I have to say that most of the time I just speak to my colleagues and friends at work to help me with that. But yeah, also in hospital there's like teaching sessions which aim to make sure that we as hospital pharmacists keep up with the guidelines. Another question is, how can I make the most out of my pharmacy degree? Well, basically what you need to know is that at uni everything you learn will be relevant, and that is whether you're going to go into industry, community pharmacy or hospital pharmacy. If you really want to make the most of it, do what I did, which is to make good notes, pass your exam and go back to those notes if you need to. That's how I make the most out of this degree. To be honest, I barely even go back to my uni notes, as you know. I just sell them and donate that money to charity. But I think that itself is making the most out of my pharmacy degree right now. For you guys, obviously with placements and stuff on hold right now due to COVID, it's going to be even harder to put what you learn into practice. But don't worry too much. Just make your notes and go back to them when you're a working hospital pharmacist. That's all I can say about that. Hi everybody, so it's Friday evening, and I have a lot more questions to answer, but I think I'm just going to end the vlog on the final KCL coursework question and answer your other questions another time. But basically, the final question is, where do I see the future of pharmacy in the next 5 years, and what can other people who are studying pharmacy look forward to? The answer to that is, I honestly don't know where pharmacy is going to be in the next 5 years. Like, I feel like our responsibilities are always changing. Like, we now have a lot more responsibility than we did, say, like 10 years ago, and that would be the same for technicians as well. Like, technicians can now do what we used to do, and I feel like all of our roles and responsibilities are constantly shifting. So I don't know where it's going to be, especially with the fact that obviously we have technology such as like robot dispensing, and like even dosset boxes being made and dispensed elsewhere by machines and then sent to community pharmacies, like that kind of thing. Like, I feel like as technology is constantly changing, so are our roles as well. Yeah, I can't tell you where we'll be in the next 5 years, but I never think that pharmacy will be a dying career. I know a lot of people worry about that, but as much as machinery can help, I think there's always like something that the human brain and interaction can bring. And I think that people will always value our counselling skills and the way that we can go somewhere and like identify an interaction, and like just we notice little things that doctors don't, and I feel like our input will always be valued somehow. So I wouldn't worry about it becoming like a dead job. And what was the other question? Oh, what is there to look forward to? Well, a stable job, essentially, I suppose. That's kind of what I think. If you're coming into pharmacy in England for the money, like, I wouldn't look forward to that, because that's not going to happen. So yeah, actually on that note, somebody did ask me if I was a millionaire, would I carry on being a pharmacist? And the answer is yes, I would. I think I'll always hold my license close to me because it took me so many years and so much dedication to actually get there. So I think I'll always be a pharmacist, but if I was a millionaire, I'll probably do other things on the side alongside pharmacy, and it wouldn't be like a necessary job. It would just be like, pharmacy would be my hobby, but I'm not a millionaire, so let's not even think about that. So yeah, I hope that this Q&A was okay. I know it was a bit patchy because I started filming like 2 days ago, and then life is really weird right now. It's just weird. Like, I am very, very demotivated, and I find it hard to find the energy. Like, I really am finding it hard, but hopefully like this video and like filming these videos helps me, so I'm trying to like bounce off and get the energy. Hopefully all this shit will blow over and we'll be able to see our families. And on that note, I just want to say hi to my brother and sister in Korea. I haven't seen you guys for so long. I miss you so much. I'm going actually crazy. I just can't wait till we can see each other face to face and be fine again. Anyway, see you in the next video.